Hello everyone, I'm Dr. Smriti Vashisht, Assistant Director at Mamta, looking for the portfolio of RMNCHA. I welcome you all to the new series of podcasts by Mamta. These series will take you through different public health issues and Mamta's contribution towards the cause. Mamta Health Institute for Mother and Child is a 3-decade-old non-for-profit organization working in different areas of health. Today, on World Hepatitis Day, we have with us renowned pediatrician and Executive Director of Mamta, Dr. Sunil Mehra. On the occasion of World Hepatitis Day, this year the theme for 2022 is Bringing Hepatitis Care Closer to You. Let's listen from Dr. Sunil Mehra. Sir, I heartily welcome you and would like you to enlighten us with your immense knowledge. Would you like to introduce yourself for our audience?
Thanks, Smriti. Thank you, and thank you for taking up the issue. I think this is one of the very important issues in the infections, which is most, I would say, underrated in terms of the importance of the disease. I am Dr. Sunil Mehra. I'm a pediatrician, as you said rightly. I'm into clinical work for the last 40 years and happen to head the institution, Mamta Health Institute for Mother and Child. Mamta as an institution has been working on non-communicable and communicable diseases for more than 1.5 decades. And in the process of the communicable diseases and / infectious diseases, it has worked on issues like acute encephalitis syndrome, it has worked on hepatitis B and C, and it has worked on various other infectious diseases that are a challenge with the like childhood diarrheas and various other components. Today is the World Hepatitis Day. Let's focus on hepatitis. Hepatitis is of 5 types: A, B, C, D, E. It's A and E which are highly prevalent because they are usually water and foodborne. Then you have B and C, which is usually transmitted through secretions, blood, and through sexual activities. Mind you, it's important to realize that hepatitis is a preventable disease. It can be prevented with good hygiene. It can be prevented through food hygiene. That is where hepatitis becomes important because the burden, honestly speaking, we don't have the magnitude. We don't even have the denominator that how many people are suffering from hepatitis, because basically many of them go undiagnosed, and hence more and more diagnosis needs to be done so that we know the burden of the disease.
On Hepatitis Day, what is your message to the community?
I would say the message for me to to children, to mothers, to families at large, in my country specifically, is that do understand that hepatitis is preventable. Do get your children immunized with hepatitis B. All pregnant mothers must be screened for hepatitis B. Because if you're positive on hepatitis B, your baby could be transmitted that hepatitis B, and this is something then you have to immunize this child for hepatitis B very early, within 48 hours of the birth. So that's one important thing to realize, that this is preventable. This is something which is preventable. Immunizations for hepatitis B and hepatitis A are available, and they are really helpful in preventing and have significant level of preventions. So try and get hepatitis B to everyone. If possible, get the hepatitis A vaccine also. And the other thing is, there are certain special groups who are more prone to hepatitis C and B as well, especially the injecting drug users. Mamta had a significant intervention for 3 years and beyond in the state of Punjab in 2 districts, where it worked with the injecting drug users to prevent, to prevent, then to identify, and to treat and manage. And hepatitis C can be cured to a great extent with the new drugs that are available in terms of the curative side.
What are the takeaways for the audience?
As you said, you began with your line on taking hepatitis closer to people, meaning thereby that at the subcenter level or at the level of the last block of health services, the information and knowledge of hepatitis must be delivered. Second, if this could be included as part of essential coverage for immunization across the country, and I think many states have already adapted it, that hepatitis B becomes as an essential part of universal coverage. Third message is, please maintain your hand and food hygiene, because it's hand and food hygiene which are the most common transmitter of hepatitis A and E. Do recognize the symptoms of hepatitis. They begin with fatigue, low-grade fever at times. You could be nauseated and you could have vomiting. You could have yellowness of your eyes and body. But hepatitis A and E, which are acute illnesses, is something you get it very early. But hepatitis B and C are chronic at times. You don't even know when you contacted it. So it's important that firstly you get immunized for hepatitis B, and if you are not immunized, be very careful of your indulging in secretions, blood transfusions and sexual transmissions.
Thank you so much, sir, for giving us your time and enlightening us with your thoughts.